Pros and cons. Pros. Air sculpt liposuction can be performed on a variety of body areas, including the hips, abdomen, love handles, arms, and back, as well as under the chin. The procedure is gentle enough that it can be performed under oral sedation with the option of local anesthesia, so there's no need for the expense or risk of general anesthesia. The friction from the cannula generates heat that triggers a natural healing response, leading to new collagen production and firmer skin in the treated area. This minimally invasive procedure comes with much less downtime than traditional liposuction, typically 1 to 3 days, compared to 1 to 2 weeks. Fat cells are removed so gently that they're still viable for transfer to add volume to the butt, hips, breasts, face, or the backs of the hands. The air sculpt cannula is so small that the entry point is just 2 mm in diameter, so tiny it doesn't require a scalpel or stitches. Cons. As with other surgical fat removal procedures, potential risks include bruising, swelling, and the possibility of infection. Not everyone has a good experience with air sculpt. Some Real Self members who rated the procedure not worth it complained of lumps, asymmetry, or not seeing a significant change post-treatment. Some reviewers also say they didn't see skin tightening results, even after waiting up to 6 months for new collagen to form. The puncture to insert the cannula can result in a small scar, but it should be tiny enough to mimic a freckle. Who's a good candidate for air sculpt? Good candidates for air sculpt body sculpting are healthy adults who want to remove pockets of stubborn fat or sculpt specific areas of their body, including the abdomen, hips, thighs, arms, buttocks, or under the chin. Like other body contouring procedures, this one isn't intended for weight loss. As the name implies, it's best used to sculpt and fine-tune specific areas of the body. Does air sculpt tighten skin? Air sculpt treatments offer mild skin tightening. It's not usually enough to make a significant difference in treating lax skin, but currently, we can pair air sculpt body contouring with Renuvian skin tightening. Renuvian is FDA cleared to treat moderate to severe lines and wrinkles for patients with Fitzpatrick skin types 1 to 3, as well as skin laxity on the neck and under the chin, the submental area. Using it for skin tightening on the body is a common, off-label procedure, but it should only be performed by an experienced, board-certified plastic surgeon. This entire fat removal procedure takes between 45 minutes and 4 hours, depending on the amount of fat removed and how many areas you're having treated. Air sculpt does have several advantages over traditional lipo. It comes with less downtime. You won't need general anesthesia. It provides mild skin tightening benefits. The downside? It's more expensive. Are results permanent? Air sculpt permanently removes fat cells, so results should be very long-lasting. You'll need to maintain a stable weight through a healthy diet and exercise to keep the remaining fat cells from expanding, which can lead to weight gain and contour irregularities. Aftercare. The necessary time needed to recover from surgery is proportional to the amount of excess fat removed. After surgery, you will observe swelling and bruising in the treated areas. Pain can vary from one patient to another, but it is usually mild with the use of thin cannulas. Fatigue is common in the first few postoperative days, especially after large liposuctions. You can go back to your usual activity 4 to 7 days after surgery, again depending on the extent of your liposuction and your type of professional activity. Bruising usually disappears 10 to 20 days after surgery. It is possible to start sports again at least 3 weeks after surgery. It is strongly recommended to wear a pressure garment for 2 to 4 weeks. The general rule of thumb was for patients to wear the garment for 1 week for every decade of life. 40-year-old patients would wear garments for 4 weeks. Liposuction postoperative instructions. Get plenty of rest. Follow balanced diet. Decreased activity may promote constipation, so you may want to add more raw fruit to your diet, and increase fluid intake. Take pain medication as prescribed. Do not take aspirin or any products containing aspirin unless approved by your surgeon. Do not drink alcohol for 3 weeks as it causes fluid retention. Do not smoke, as smoking delays healing and increases the risk of complications. Start walking as soon as possible. This helps to reduce swelling and lowers the chance of blood clots. You may shower 48 hours after surgery. After showering, reapply pressure garment and gauze to cover areas of incisions. Do not drive until you are no longer taking any pain medications, narcotics. Strenuous exercise and activities such as sports should be avoided for 3 to 4 weeks, depending on the extent of the surgery. Avoid exposing scars to sun for at least 12 months. Always use a strong sunblock, if sun exposure is unavoidable, SPF 30 or greater. Keep incisions clean and inspect daily for signs of infection. No tub soaking while sutures or drains are in place. You will be discharged wearing a pressure garment. Wear pressure garment 24 hours per day for 6 weeks. What can I expect to feel? Most of the swelling and discoloration usually subsides in 6 to 8 weeks, but some may persist for 6 months or more. Expect temporary numbness, bruising, swelling, soreness, burning sensation, bleeding, pain and discomfort. May have fluid drainage from incision sites. A drainage tube may be inserted beneath the skin to prevent fluid buildup. It is normal to feel a bit anxious or depressed in the days or weeks following surgery, but, generally, after about a week, you will begin to feel better. A healthy diet and regular exercise helps to maintain your new figure. When should I call my doctor? If you have increased swelling or bruising. If you have increased redness along the incision. If you have severe or increased pain not relieved by medication. If you have any side effects to medications, such as rash, nausea, headache, vomiting. If you have an oral temperature over 38 degrees. If you have any yellowish or greenish drainage from the incisions or notice a foul odor. If you have bleeding from the incisions that is difficult to control with light pressure. Complications.